Well, President Cyril Ramaphosa spoke this week about herd immunity once the majority of South Africans are vaccinated. But scientists at the World Health Organization warn that may not be the case. Meanwhile, South Africa could experience a third and even fourth wave of infections. Medical scientist Professor Tivani Mashamba-Thompson speaks to us now about this. And Prof, thank you so much for your time and welcome to the South African Morning. I mean, before we get into the issue around vaccines, etc., I mean, talk to me about, I suppose, the fear that even Professor Abdul Salim Karim spoke about among South Africans as to whether or not, firstly, there is COVID-19, second of all, if the second wave exists, and thirdly, if this vaccine is really effective and if anyone should even entrust it.
Yes, good morning to me and thank you for having me. And yes, we are observing a lot of, demotivation among our public in South Africa, and we're all not trusting the messages that we're getting. And then this is also further exposing us to more danger. People are more demotivated to follow the COVID-19 recommended protective measures. And, and this is also can be defined as pandemic fatigue, and it's very common in a pandemic. And it seems to be emerging more gradually with this pandemic. And, this is caused mainly by also these messages and misinformations and, a number of emotional experiences and perceptions that most of us now have about the pandemic.
Right.
And so it's very dangerous.
Yeah, it is. So in essence, you are saying as a medical expert with whom we should entrust, because this is your work, that COVID-19 does exist. But more so, I mean, we're learning that there's even more likely a possibility that not only are we experiencing the second wave, but there might be a possibility of even a third and a fourth wave in the country.
Yes. I mean, looking at the, just what I've just explain to you, the fatigue that we are experiencing now, the pandemic fatigue, and absence of the treatment and vaccine. If you combine the three together, the chances of us going into the third and the fourth wave are pretty high. So if we don't change our behavior, and also, if the resources are not directed to more behavioral interventions to help us with this demotivation, and in absence of the treatment and vaccine, we can't avoid future waves.
Right. I mean, the president has mentioned that obviously at this time they are prioritizing healthcare workers, at least targeting 10% of the population, saying at least 20 million doses of vaccines or so will be, of course, prioritizing healthcare. And the rest, of course, will be rolled out later on to the rest of the population, at least around 60%. The president, I think, said that's their target. For you, Prof, is this enough? Will this be enough to almost sort of stop or curb that potential third and fourth wave?
Yes, that reported amount of vaccine is obviously not going to help us reach the herd immunity that's required to help protect us. So the spread will continue, and as you already heard from the health minister, the vaccine is also not a silver bullet. It's not going to help with preventing the virus. People who are vaccinated can continue infecting others when they are exposed to the virus. So, there need to be even more emphasis on other interventions rather than just a vaccine.
Yeah.
And like I said, we are also experiencing a lot of demotivation to COVID-19 messages or following COVID-19 preventative measures. So also there are people who are also against the vaccine. So more, interventions that are helping with, communicating messages to different populations are required at the moment.
Yeah, I think
so
that's
you rely on a vaccine alone.
You say something important here, and I think you are clarifying a lot of, probably the myths that we're hearing, that, or even the impression or the expectation that this vaccine will be the silver bullet, almost acting like a cure to save everyone. But you're saying that there still needs to be a behavioral change, even when the vaccine around. People still need to follow some of the health guidelines to ensure that they are safe and others are safe as well. That's what you're saying.
Yes, that's exactly what I'm saying. And also what I'm calling for, the government to put more resources on behavioral interventions that can help with changing the perceptions, which, are causing the motivation to following the preventative measures, which, is more important than even a vaccine.
Prof, thank you so much for your time. Quite important points you mentioned there. Professor Tivani Mashamba-Thompson joining us.